Welcome to this lecture on psychology for nurses. In this first module, we will delve into foundational concepts, including psychological models of health, child and adult psychology, pain management, and support for individuals with learning disabilities and dementia. Let's begin. 1. Psychology and models of health. In nursing, the way we understand health affects how we provide care. Psychology offers several models that help explain the factors influencing health. A biomedical model. This model views health purely from a physical perspective. Illness is seen as a deviation from normal biological functioning, and treatment focuses on curing the disease. While useful in many medical situations, this model neglects psychological and social influences. B. Biopsychosocial model. Developed by George Engel, this model integrates biological, psychological, and social elements. It sees health as a product of not only genetics or pathogens but also mental health, relationships, culture, and socioeconomic status. Nurses using this model are more holistic and sensitive to individual patient needs. C. Health belief model. This model suggests that people's beliefs about health problems, perceived benefits of action, and barriers to action can predict health-related behaviors. For example, a patient might avoid medication if they believe it's harmful, even if it helps them. D. Trans-theoretical model of change. Also called the stages of change model, it outlines how people progress through stages when changing behavior: pre-contemplation, contemplation, preparation, action, and maintenance. Nurses can apply this model in health promotion, especially for conditions like diabetes or hypertension. Understanding these models enables you to support your patients with empathy and effectiveness, not just by treating symptoms but by encouraging healthy behaviors and providing emotional support. 2. Nursing the child and young person. Children are not just small adults. They have unique psychological and emotional needs, and their developmental stage greatly influences how they understand illness and respond to care. A. Developmental psychology. Jean Piaget's theory of cognitive development explains how children's thinking evolves through 4 stages: sensory-motor, pre-operational, concrete-operational, and formal-operational. Knowing where a child is in this process helps nurses communicate effectively. For example, a 4-year-old may see illness as a punishment for bad behavior, while a teenager may understand complex causes. B. Attachment theory. John Bowlby's theory emphasizes the importance of secure attachments. Separation from parents during hospitalization can be traumatic for children. Nurses can support children by encouraging parental involvement and using therapeutic play to reduce anxiety. C. Adolescent psychology. Teenagers value independence and identity. They may resist treatment, experience body image concerns, or engage in risk-taking behaviors. A nurse's role includes providing accurate information, maintaining confidentiality, and involving them in care decisions. 3. Nursing the adult. Adults vary widely in personality, culture, and coping mechanisms. Understanding adult psychology helps nurses provide care that respects autonomy and encourages positive health behavior. A. Erikson's stages of psychosocial development. Adults go through stages like intimacy versus isolation, generativity versus stagnation, and integrity versus despair. Nurses should recognize where patients are in their psychosocial development to offer appropriate support. For instance, a young adult may be more concerned about relationships, while an older adult may be reflecting on life. B. Coping and adaptation. People use different coping strategies, such as problem-solving or emotional avoidance, when facing illness. Nurses can assess coping styles and teach healthier methods through therapeutic communication. C. Cultural sensitivity. Culture shapes beliefs about illness, pain, mental health, and even death. Psychologically informed nursing practice requires cultural competence, being aware of cultural norms, communication styles, and belief systems without judgment. 4. Nursing those with learning disabilities. People with learning disabilities, LD, may struggle with communication, understanding, and social interaction. They are also more vulnerable to neglect or poor care if misunderstood. A. Psychological understanding. LD includes conditions like Down syndrome, autism spectrum disorder, and intellectual disability. These individuals may have difficulty expressing discomfort or needs. Nurses must observe nonverbal cues, such as changes in behavior, eating, or mood. B. Building trust. Establishing trust is essential. Familiar routines, simple language, visual aids, and patience go a long way. Involve family members or caregivers who understand the patient best. C. Person-centered care. Psychological care of individuals with LD means seeing them as capable and valuable. Their dignity must be upheld. Give them choices when possible, explain procedures gently, and provide emotional reassurance. 5. Nursing people with dementia. Dementia affects memory, thinking, and social abilities, significantly altering behavior. Patients may become confused, fearful, or agitated, not because they are difficult, but because they are living with a deteriorating mind. 8. Types of dementia. The most common type is Alzheimer's disease. Others include vascular dementia and Lewy body dementia. Though the causes differ, the psychological needs of patients often overlap. B. Personhood in dementia. British psychologist Tom Kitwood emphasized person-centered care, focusing on the person, not the disease. Even as memory fades, the individual retains emotions, preferences, and the need for respect. C. Communication strategies. Use calm tones, simple instructions, and eye contact. Avoid arguing if a patient is disoriented. Instead, validate their feelings. Nonverbal communication, like smiling or holding a hand, often speaks louder than words. D. Emotional support for families. Caring for someone with dementia is emotionally taxing. Nurses must extend psychological support to families, explaining the condition, connecting them with resources, and listening to their grief or guilt. 6. Nursing those in pain. Pain is not just a physical sensation. It also has emotional, psychological, and cultural dimensions. Patients in pain may be anxious, irritable, or withdrawn. A. Gate control theory. This theory, proposed by Melzack and Waugh, suggests that pain signals can be modulated by psychological factors. For example, distraction or relaxation can close the gate to pain signals. B. Psychological assessment of pain. Ask not only where it hurts, but how it affects daily life. Does the pain cause fear, depression, or sleep problems? A holistic pain assessment tool like PQRST, provocation, quality, region, severity, time, is useful, but so is listening compassionately. C. Coping mechanisms. Help patients develop non-pharmacological pain management strategies such as deep breathing, guided imagery, music therapy, and positive thinking. 7. Nursing those at the end of life. End-of-life care is deeply psychological. Patients face fear, grief, regret, and spiritual questions. The nurse's role here is to offer not just comfort, but peace. A. Stages of grief. Elizabeth Kubler-Ross outlined 5 stages: denial, anger, bargaining, depression, and acceptance. These are not linear and differ from person to person. Nurses must recognize where the patient is emotionally and provide support without pushing. B. Communication. Talk honestly but sensitively. Allow patients to express fears, regrets, or wishes. Silence can be therapeutic too. Sometimes, presence is more powerful than words. C. Supporting the family. Families also go through anticipatory grief. Nurses can help by listening, giving information, and encouraging them to be present with the patient during their final moments. D. Cultural and spiritual considerations. Respect beliefs about death, the afterlife, and rituals. Some may want prayers, others may want quiet. Psychological care at this stage honors the individual's values and dignity.